Welcome to the Putting the Public into Health podcast by Dr. Richard Pan. As we face one of the greatest public health disasters in a century, this podcast will address questions and issues from you, the public, about the COVID-19 pandemic and its impact on people's health and lives. I am Dr. Richard Pan. I'm a physician with a background in public health, and I'm proud to represent the people of Sacramento, Elk Grove, West Sacramento, and parts of Sacramento County in the California State Senate. I want to share with you important information and stories to help each other during this difficult time. Last week, America reached a terrible milestone in the COVID-19 pandemic. Over 100,000 of our fellow Americans died of COVID-19. 100,000 people who were someone's parent or child, brother or sister, friend or neighbor. The first known COVID-19 death in the U.S. happened on February 6th of this year in Santa Clara County, and less than 4 months later, our country passed 100,000 confirmed deaths. So how many people is 100,000? Sacramento Memorial Auditorium, a favorite graduation site, has 3,867 seats. The Golden One Center holds 17,608 fans for a Kings game. Sacramento State enrolled 31,156 students last fall, and UC Davis enrolled 39,329 students, or together only 70,485 students total. The largest school district in our region, Elk Grove Unified, has only 63,917 students. And the city of Sacramento, the sixth largest city in California, has a population of 508,529. So in 4 months, we have already lost the equivalent of a fifth of Sacramento's population in this country because of COVID-19. Unfortunately, there are some who dishonor the memory of the dead by denying that these deaths were caused by COVID, or falsely blaming the deaths on the patients themselves because the patient had a pre-existing condition. People who are older or who have lung or heart disease or diabetes are more likely to die from coronavirus infection, but they did not deserve to die. In fact, the people who died of COVID-19 were found to have lost over a decade of life on average. We are also witnessing significant racial disparities in COVID deaths, where blacks and Native Americans are dying at a much higher rate. And as horrific as 100,000 deaths is, experts believe we are undercounting deaths from COVID-19. Many deaths from COVID were not counted because patients were not tested for coronavirus prior to their death, so the infection was not confirmed. This is particularly true of people who died at home of COVID. A strong indication that COVID deaths are undercounted is excess mortality data. Excess mortality are deaths beyond the number that is normally expected in a given population during a given time period. There are tens of thousands of additional deaths in early 2020 when COVID spread in our country. Some people have also falsely claimed that COVID-19 is no more serious than the flu, although they don't often emphasize that there is a flu vaccine to prevent infection and medication that lessens the severity of flu, whereas there is no COVID vaccine or effective treatment yet. Influenza is a serious disease that the CDC estimated killed 61,000 people in the 2017-18 flu season, although the flu typically causes 20,000 to 40,000 American deaths each season. Research indicates that COVID-19 spreads more easily and has a higher death rate than the flu. I would also note that the estimated number of deaths from flu is not an equivalent measure for the number of confirmed COVID deaths. As previously noted, COVID deaths are undercounted. When epidemiologists are finally able to collect and review all the data on symptoms and infections, the estimated deaths from COVID is likely to be greater. Given that the number of confirmed COVID deaths in a shorter time period is much greater than the estimated flu deaths for a full flu season, there can be no question that COVID is much more deadly than the flu. COVID-19 spread in the United States during the tail end of this flu season. Next fall, coronavirus infections may spike at the same time as the flu, overwhelming our doctors, nurses, and hospitals in a second wave of disease. We will not have a coronavirus vaccine by fall, but we do have a flu vaccine that can prevent infection or lessen its severity. To save more lives, we need to boost flu vaccination rates from the usual 40% to more than 70% of Americans receiving the vaccine this fall. Americans dying because there are not enough hospital beds and ventilators or doctors, nurses, and respiratory therapists to care for all of the patients would be a preventable tragedy. California was one of the first states to implement a stay-at-home order, 12% of Americans reside in California, but has less than 4% of the deaths. Unfortunately, that still means almost 4,000 Californians have died of COVID-19. If our country acted to implement physical distancing at the beginning of March, 2 weeks before the Trump administration issued distancing guidelines, scientists determined that 90%, or more than 90,000 deaths, could have been avoided. New York implemented stay-at-home orders only a week after San Francisco, but the contrast of what happened in each city is terrifyingly illuminating. New York implemented stay-at-home orders only a week after San Francisco, but the contrast of what happened in each city is terrifyingly illuminating. Two densely populated cities which are the hubs of commerce and travel for the nation. Yet New York City had hospitals full of patients on ventilators and overflowing morgues, and San Francisco did not. Days matter when it comes to saving lives. On 9/11/2001, we lost 2,996 Americans from terrorist attacks. In response, our country rallied together and took major steps to prevent future attacks, and we mourned our loss as a nation. On December 7, 1941, 2,403 Americans lost their lives on an attack on Pearl Harbor. The President declared it a day which will live in infamy, and our country chose sacrifice and to fight back. Should we not do as much to stop the coronavirus, which has slain so many more Americans? Every one of us is on the front lines of stopping this disease. We can stay at home as much as possible, remembering that doctors, nurses, firefighters, police officers, grocers, truckers, janitors, farm workers, and many other essential workers cannot avoid working in places where they may be exposed to the disease. We can physically distance and stay 6 feet from people outside our household so we don't spread the infection. We can avoid large gatherings, especially indoors, when many more people would get infected and bring coronavirus home to their families. We can wear a mask to protect others, remembering it is even harder to breathe if intubated on a ventilator. And we can wash our hands frequently to avoid bringing the virus from a frequently touched surface like a door handle to our face and into our body. We will do these things not because we're told to do so by the government, but because we care about our family and our country. America's strength comes from our ability to face the facts, no matter how difficult, and working together to solve our problems. The vast majority of Americans believe in our country and choose to keep their families and communities safe by doing their part to prevent COVID-19 from sickening our country. Let us now take a moment of silence to pray and remember the over 100,000 fellow Americans who already died of this terrible disease, COVID-19. May they rest in peace. Let us resolve to remember our country's loss by doing everything we can to prevent any more of our fellow Americans from sharing this fate. This is Dr. Richard Pan. Thank you so much for listening.